Taurine is a semi-essential amino acid. Although scientists have known about it for 2 centuries, its health benefits have only recently become clear. Taurine supplements are non-toxic, inexpensive, and freely available. Taurine is a sulfur-containing amino acid. It's present in the body in almost every tissue, and it's concentrated in key areas like the heart, the brain, and the retina. A taurine-rich diet can protect the body and promote longevity. Yet taurine has a bad reputation because it's a popular ingredient in unhealthy energy drinks. Taurine plays various important roles in the body, including the regulation of the water status in our cells, preventing oxidation in the body, and supporting calcium signaling in key organs. Through the calcium regulation properties, it helps to improve the function of the cardiac, nervous, and musculoskeletal tissue. Heart and blood vessels contain taurine transporters, and it suggests that taurine is important for heart function. A taurine-deficient diet induced heart disease in several animal studies. The risk of chronic heart disease is lower in individuals with a higher urinary output of taurine. In a study of 22 healthy middle-aged women, 3 grams per day of taurine supplements for 4 weeks lowered homocysteine levels. Since homocysteine is correlated with heart disease, taurine might help to prevent heart attacks and high cholesterol. Studies show that taurine might have a role in preventing abnormal heartbeat, or AFib, through supporting the ion transport system of calcium and sodium channels that's necessary for electrical activity of the heart. Taurine supplementation is effective for treating the hardening and the narrowing of blood arteries in animals. Though the evidence is not large-scale yet, there's a growing number of studies linking taurine to lower blood pressure. Some studies show that low taurine levels are associated with increased blood pressure. Oral taurine supplementation is potentially very safe and convenient for the control of high blood pressure in the presence of an overactive sympathetic nervous system. The consumption of 3 grams per day of taurine every day for 2 months in hypertension patients reduced both the systolic and diastolic blood pressure. It also plays a protective role in heart and kidneys in rats with hypertension. Taurine shows the ability to break down cholesterol. However, there's no evidence to suggest that it will lower blood cholesterol other than in animals who are fed a high-fat diet. Taurine supplementation can enhance bile secretion and activity, and it can improve the breakdown of cholesterol in the body. It's also essential for the formation of bile salts, and as such it plays an important role in fat and cholesterol absorption and breakdown. In a single study of 51 young women with iron deficiency anemia, taurine and iron supplementation helped to restore the markers of iron sufficiency better than iron supplements alone. The best evidence of the benefit for taurine supplementation comes from research on cardiovascular health. In multiple clinical studies, taurine improved the markers of heart disease, including cholesterol and blood pressure, as well as the iron status. It's very likely that taurine plays an important role in the liver health, but the clinical significance is still unknown. The most promising correlation is that taurine might lower the pressure in the main vein leading into the liver, the portal vein. Because of this, it might help those with liver cirrhosis. The dietary supplementation with doses greater than 500 milligrams per day for 3 months reduced liver injury in 24 chronic hepatitis patients. In rats, dietary taurine protected their liver from heavy metal and oxidized fat-related damage. The availability of taurine in the body is low in various forms of liver cirrhosis. In 35 liver cirrhosis patients, daily taurine supplementation increased the taurine levels, and it also reduced the painful muscle cramps that are associated with cirrhosis. In animal models, taurine is effective for preventing non-alcoholic fatty liver disease. It reduced oxidative stress, cell death, and fat accumulation in the liver. Taurine supplementation also prevented alcoholic fatty liver disease by decreasing the alcohol-induced oxidative stress and inflammation in animals. It also increased the production of proteins that are associated with the fat breakdown in the liver. Animal studies suggest that taurine prevents the long-term liver damage and helps the liver cells recover faster from alcoholic fatty liver disease. Tissues exposed to oxidative damage have been found in the lab to have particularly high concentrations of taurine. Like other antioxidants, taurine directly and indirectly eliminates the harmful oxidants to minimize the tissue damage. Through its antioxidant and anti-inflammatory activity, the taurine helps to protect our bodies from the unnecessary cell death and the tissue damage. White blood cells produce oxidants like hypochlorous acid, and these destroy invading microorganisms and fight infections. However, these oxidants can also harm the body's cells. Taurine can scavenge these oxidants to form the much less toxic taurine chloramine and taurine bromamine. These are able to reduce the generation of oxidants by the white blood cells. Taurine also increases the production and the activity of other antioxidants that are found in the body. Taurine's antioxidant activity might be able to protect the lungs from damage caused by exposure to toxins like cigarette smoke. Hamsters who are fed taurine are able to resist lung damage caused by air pollutant exposure. Maintenance of tissue taurine levels is critical for the prevention of oxidant-induced lung injury in rats. In sheep, a taurine derivative prevents lung damage caused by bacterial toxins. Taurine is believed to play a role in the body's innate antioxidant pathways, but the role of taurine supplementation for oxidative stress is unknown. The antioxidant action of the taurine produces taurine chloramine and bromamine, and these have anti-inflammatory properties. Taurine supplementation enhances the formation of these, and it might be effective against inflammatory conditions. Taurine is very effective for treating acute inflammation, which is caused by infection, irritants, damaged cells, or cancer. However, its role in the progression of inflammatory diseases like arthritis is not as clear. Diminished generation in the body can worsen the inflammation-related joint damage in rheumatoid arthritis. Injections improved arthritis symptoms in various experimental animal models. The gene for the taurine transporter has also been linked to the inflammatory response. It promotes cell death via apoptosis or programmed cell death. Because the dead cells are then immediately consumed by the white blood cells, they're not left to release toxins and the inflammation can be reduced. It can also turn on genes that reduce inflammation. In human cells, high concentrations reduced the inflammatory cytokine production. Antioxidants like taurine are low in diabetic individuals. This increases the risk of oxidative damage. Diabetes lowers the body's ability to absorb taurine. Diabetic complications like heart, kidney, and nerve damage can be attributed to high oxidative damage resulting from low taurine levels. In a study of 39 type 1 diabetic patients, the oral supplementation with 500 milligrams of taurine 3 times per day for 3 months restored the taurine levels in the blood. The taurine supplementation also prevented blood cells from clotting together, decreasing the heart attack risk. In rats, taurine also reduced the blood sugar by interacting with insulin receptors in the cells. Taurine's role in protecting the kidneys from damage in diabetes is also well documented in animal models and in human cells. 1.5 grams of taurine every day for 2 weeks improved the early heart abnormalities in a study of 9 type 1 diabetic patients. People with diabetes might have difficulty absorbing taurine, and therefore they might be more likely to be deficient in taurine. In at least one study, supplementation corrected the problem. Taurine is essential for the normal functioning of muscles. In a study of 29 elderly individuals suffering from heart failure, 500 milligrams of taurine 3 times per day for 2 weeks increased the exercise performance. Muscle function is severely impaired in mice that lack the taurine transporter. Taurine supplementation improves physical endurance in the rats. Taurine supplementation can be used to restore taurine levels in the muscles that are decreased after exercise. The mechanism of action of taurine in the muscles might include the alteration of protein production, and it will probably vary from species to species. Animal studies suggest that taurine is vital for the normal function of the muscles. In elderly people, taurine supplementation increased exercise performance. Taurine protects the cells of the retina from damage caused by oxidants and bright light. In a study on 62 patients, a combination of taurine with vitamin E helped to prevent vision loss by protecting against the oxidative damage. Low taurine levels are associated with cataract formation in humans. In cats, taurine deprivation causes vision loss. In rats, the anti-epileptic drug vigabatrin depletes taurine from the retina. As a result, prolonged use of the drug causes irreversible loss of vision. Taurine is required for the correct functioning of the eye, but it's unclear to what extent taurine supplementation can prevent vision loss or eye disease. In a human trial, a combination supplement that included taurine helped prevent vision loss. In animals, like cats and rats, taurine depletion results in progressive blindness. Taurine may have a role for reducing body weight in overweight and obese patients, possibly due to its role in bile synthesis and fat absorption and breakdown. In a study of 30 obese college students, 3 grams of taurine per day for a week was able to significantly improve fat profiles and reduce weight. It also improved markers of fat breakdown in people of a healthy weight. In experimental animals who are fed high cholesterol or high fat diets, the taurine improved the fat breakdown. Cystic fibrosis is a genetic condition, and it can affect many organs in the body, like the lungs, the kidneys, the pancreas, and the intestines. One of the symptoms of cystic fibrosis is fatty stools. Taurine supplementation can help to manage the fat absorption in the cystic fibrosis patients. In a small study of 19 children with cystic fibrosis, the daily taurine supplementation for 6 months had a positive effect. The taurine was able to significantly improve the fat reabsorption in these individuals. Vitamin E deficiencies resulting from malnourishment in cystic fibrosis patients might also be improved with taurine supplementation. A single clinical study found that taurine supplementation improved the fat reabsorption in the children with cystic fibrosis. Taurine may heighten and mimic the GABA activity in the brain. It can calm the brain and the nervous system in patients with epilepsy and seizures. Taurine levels are lower in individuals who are suffering from epilepsy. In 9 patients with intractable epilepsy, the seizures disappeared in 5 of the patients when they received 1.5 to 7.5 grams of oral taurine every day for 2 weeks. Unfortunately, high doses of taurine in certain instances have the potential to cause seizures. It can cause amino acid levels to become unbalanced and have negative effects instead. So you should talk to a doctor before supplementing with taurine if you're at risk of seizures. In about 1/3 of the tested patients with epilepsy, the taurine supplementation significantly reduced the incidence and the severity of their seizures. In a study with 22 patients, the daily dietary supplementation with 1 gram of taurine reduced the number of psychotic episodes in the individuals who were undergoing alcohol withdrawal. Taurine supplementation in rats undergoing alcohol withdrawal was able to completely reverse the alcoholic fatty liver disease. Some of the benefits of taurine during alcohol withdrawal might stem from its inhibitory action on the brain and the nervous system. Some research has suggested that taurine might help with the alcohol withdrawal symptoms. Most of the studies in the area have been done on animals, so more research is needed on humans. There's mounting evidence that the increased consumption of taurine-rich seafood by the Japanese people contributes to their longevity by reducing the risk of heart disease. However, additional research is needed to confirm this. In a study on 121 young adults with psychosis, taurine supplementation along with conventional antipsychotic medication produced fewer pathological symptoms than the medication alone. Autism is associated with increased oxidative stress to the brain and the nervous system. Taurine is believed to have the potential to improve the symptoms of autism due to its antioxidative properties. Children with autism have low levels of taurine, so taurine supplementation may in theory help to elevate the levels of taurine and help the condition. Some researchers believe in the acidic environment of inflammation, taurine products could have significant antimicrobial activity, but this has yet to be confirmed. The taurine products are able to kill a wide spectrum of bacteria, fungi, yeasts, molds, viruses, and parasites that are directly exposed in the cell studies. Because of this property, the taurine byproducts are under investigation as potential treatments for infections like chronic sinusitis, swimmer's ear, acne vulgaris, and gum disease. The taurine products rapidly break down in our bodies, and they're only effective if used topically, not when supplemented. However, taurine supplements might increase the production of these compounds within our body. According to an animal study looking at the white blood cell levels of mice with lung cancer, taurine's role as an antioxidant is also important for the protection of the cells in our immune system after chemotherapy. Another animal study showed the white blood cells, the neutrophils, of rats who are supplemented with taurine have an increased ability to destroy invading bacteria. Taurine and its derivatives have the potential to disrupt biofilms and possibly help the body to fight off infection, but more research is needed. Multiple animal studies have found that taurine appears to protect the kidneys from oxidative damage and from an interrupted blood supply. Although bone cells contain taurine, scientists are unsure of taurine's function within the bone. However, they do think it helps with the bone formation and balance, or homeostasis. In rats, dietary taurine and arginine supplementation help to increase bone mineral density. This helps to improve bone health and protect from fractures. Cell and animal studies suggest a role for taurine in bone formation. No human studies are available in this area yet. In mice, topical taurine treatment helped to heal wounds by improving cell strength. Topically applied taurine also prevented dry and scaly skin by reducing inflammation and toxicity in the human skin cells. Dietary taurine supplementation eliminated tinnitus, or constant ringing in the ear. Higher amounts, 4 mg per ml versus 1 mg per ml, and frequency of taurine supplementation yielded better results. The GABA-like calming action of the taurine in the brain's auditory circuits might be responsible for this improvement. It might also be its powerful antioxidant effect. Taurine is one of the most abundant free amino acids in the male reproductive system, and it can be synthesized by male reproductive organs. Dietary taurine supplementation increased the motion and the survival of sperm in rats. Taurine might act as an antioxidant in the testicles and improve sperm quality, especially in aged animals. The protective effect of taurine on the sperm cells might also be a result from its role in controlling cell volume. Taurine is found in high concentrations in the female reproductive system also. It can protect the gametes and the growing embryos in the womb from oxidative damage. The role of taurine supplementation in fertility is currently unknown. Further research will determine if it can improve fertility and otherwise aid in reproduction. There's a positive correlation between taurine levels and thyroid function. Hyperthyroidism patients have lower levels of taurine in their blood compared to healthy patients. In rats, taurine supplementation protected against oxidative stress that was caused by hyperthyroidism. Taurine supplementation had anti-anxiety effects in rats. It interacts with the calming neurotransmitter GABA in the brain and could help with anxiety control. In rats, taurine helped to alleviate depression by changing the activity of the hippocampus in the brain. Taurine pre-treatment in rats also helped to prevent depression and anxiety symptoms after stress exposure. In rats, taurine antidepressant activity could be due to its ability to prevent hypothalamic pituitary adrenal axis dysfunction, to promote nerve cell formation, survival, and growth in the hippocampus, prevent the decrease of 5-hydroxytryptamine, dopamine, and noradrenaline, and stop the increase of glutamate and corticosterone. Alzheimer's disease is associated with the over-excitation of neurons due to the action of the excitatory neurotransmitter glutamate. Taurine has the ability to block some of these excitatory signals in the brain and to help treat Alzheimer's. Taurine achieves this by its GABA-like action in calming the nervous system. In human cells, taurine reduced the neurotoxicity of glutamate. In mice with the animal model of Alzheimer's, drinking taurine in their water helped recover their memory and their learning. Taurine supplementation for Alzheimer's disease is currently under investigation in animal trials. Due to the aging process, the brain becomes less efficient at producing and responding to GABA, a neurotransmitter. Since taurine functions similarly to GABA in the brain, taurine supplementation might reverse some of these effects. Taurine supplementation in aged mice showed a significant improvement in memory formation and retention. The young mice showed no improvement in learning and retention after the taurine supplementation. However, the taurine induced several biochemical changes in these mice that might promote better aging. The cell protective effects of taurine could also contribute to an improvement in cognitive function observed after chronic supplementation with the taurine. Long-term continuous taurine supplementation is likely more effective than the short-term dosing, since the brain levels of taurine were not significantly altered after a single dose. Some researchers have suggested the taurine could play a role in memory formation and retention. Taurine, through its anti-inflammatory action, reduced ADHD-like behaviors such as hyperactivity in rats. Although it helps to reduce anxiety, there's not much evidence in regards to treating humans with ADHD at the moment. Taurolidine, a derivative of taurine that turns into taurine within the body, increased the cancer survival rate in animal models. Cancer patients have depleted taurine levels. Surgery and chemotherapy decrease the taurine levels even further and might compound the taurine decreases in the cancer patients. Some researchers therefore believe taurine supplementation might be greatly beneficial in cancer patients. In a study of 40 chemotherapy patients, taurine supplementation decreased the incidence of nausea and vomiting after the treatment. Taurine is a sulfur-containing amino acid and is required for the normal functioning of the human body. Its clearest benefit is to the heart and the liver, while other human studies indicate potential anti-inflammatory, antioxidant, anti-diabetic, and anti-obesity benefits. Some researchers also believe that taurine can help with epilepsy, eyesight, exercise performance, and some mental health concerns. Animal research is also currently ongoing into cancer applications. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.